Alright, I come in, provide for privacy, wash my hands. I check the MAR and we have an order to give hydromorphone 1 milligram IV push every 3 hours as needed for pain for our patient Bob. So I would also come in, introduce myself. Hi Bob, my name is Michelle. I'll be your student nurse today, and I have an order to give you some pain meds. I heard that you were having some pain. He says he was. For me to do that, can you verify your name and date of birth? He says Bob Owens, 9/22/33, which matches the MAR and his band. Can you tell me any allergies that you might have? He says morphine. Well, we won't be giving you that today. We'll be giving you a different medication, hydromorphone. So you shouldn't have any problems with that. Have you received this med before? He says yes, a couple years back when he was here. And we don't have any record of giving this, so we were able to give this. I calculated my math already, and I gathered all my supplies here. I would make sure that I also grabbed a heparin syringe if my facility required me to do so. And we would also want to make sure that he has this line. We'd want to make sure, check it daily to make sure that the reason he has this is valid every day. And he has this line because he's receiving long-term antibiotic therapy. So we're just going to get a few things ready here. All right. I'm going to check my med with my MAR, and my expiration date is 3/20/20, so this is still good to give. So I have hydromorphone, 1 milligram, so that's good. Hydromorphone for Bob. All right, we're giving that IV push every 3 hours as needed for pain. Hydromorphone, it's good. All right, for Bob. Okay, and that should be good there. So we're just gonna get everything ready here. Cleanse our cap. This facility requires alcohol swabs, so that's what we'll be using. And Bob, are you going to be able to keep that arm steady for me while I give this and let me know if anything feels weird? He says yes, and I swab for 15 to 30 seconds for via my facility requirements. And I already says that he's able to verbalize and understand my commands. So we're just going to get this ready. And after doing my math, I figured out that we will be giving 0.5 milliliters of the hydromorphone. And I checked the Betty book, and we'll be giving that over 2 to 3 minutes. And it should be diluted with 5 mils of normal saline. So I'm going to draw back that 0.5 of air to inject in my vial. 0.5. And I put my vial access device on. Okay, and my top is cleansed, so I'll put this in, check my air, turn it, and we'll draw back our 0.5. Get any air bubbles out. And then I just want to put this cover on to make sure everything is good with that. I'll make sure that it's still accurate. 0.5. All right. And then I'm going to do my 5 checks. So I have Bob Owens, and we're giving hydromorphone, 1 milligram IV push every 3 hours as needed for pain, and after calculations we'll be giving 0.5 mLs, which is right. I have Bob Owens, hydromorphone, expiration date's good, 1 milligram IV push every 3 hours as needed for pain, and after math that would be 0.5 mLs, that's good. I have Bob Owens, and we're giving hydromorphone, 1 milligram IV push every 3 hours as needed for pain, and after doing the math, we should have 0.5 mLs, and that looks right. So, after that's ready, I'm going to get some flushes ready here. Make Make sure there's no air in any of these. That's good. Right, and then we'll check the expiration date of our syringes, and those look good. You don't want to use anything that's expired. So then what we're going to do, we'll wash our hands quick. I'm going to get a label out because I need to label once my med is diluted. And the Betty book here says to dilute it in 5 mLs of normal saline, and it is obviously compatible with normal saline. So I'm going to waste until I have my 5 mLs here to dilute. Draw back a little. Inject this in here. You want to make sure you get any air out, but you don't want to waste any med. This on. And then I have my label here that I'll put on my syringe so I know which one is my med and which ones are my flushes. All right. Wash your hands quick. How you doing, Bob? I got that medication ready for you. We'll get that in you as soon as we can here. All right, put my gloves on. All right. Want to cleanse for 15 to 30 seconds on the site. And you just want to assess your site too for any redness or signs of infection, infiltration, or dislocation. Everything here looks good. So once that's cleaned, toss that. Get our flush ready. This on. Unclamp. Put that in. Everything good, Bob? He says yes. All right. That one. Cleanse again. All right, Bob. I'll be giving your med here shortly, so let me know if you feel any different than normal, any dizziness or lightheaded or anything like that, okay? But you said you've had this before, so we shouldn't have an issue. All right. And I have my med here with the label. And since that is dry, we will give this over 2 to 3 minutes. So I'll look at my clock over here. And screw this on. Unclamp. Little. Wait a little bit. Do a little more. Wait a little bit. Give some more. And then we'll say that it's been 2 to 3 minutes, so we'll get that all in him. Stop that. Untwist. Right there. Cleanse again. Then our last flush here, we want to give the first 30 seconds at the same rate as we administer our medication, because you don't want to be giving your patient a big bolus of pain medication, because that would not be very good. All right. And then, because this is a pick, after this we'll pulse that. So we give our first 30 seconds, the same rate. All right, and then we'll pulse. Take that off. right, Bob. There you go. And then we will take our gloves off, wash our hands, dispose of our supplies in the correct area. Make sure our patient's safe, the bed is low, they're comfortable, side rails are up, their call light is within reach. And if this was a child, I could have a parent there or offer them a stuffed animal to make them feel a little bit better if they were scared. I'd want to document the date and the time that I administered my med and any other assessment findings, how the patient reacted. Yeah, I think that is it.